what you're here for is probably one of the, well, it is, I think, the most important thing going on in our country today. And that is how we can, as I truly think, the most important nation in the world, we've got to figure out a way to be sure that we have an ability to cover every American with affordable health care. That people with pre-existing conditions will be able to either qualify or be able to buy insurance that they can afford. There's a lot of moving parts to the health care legislation, and we're working on about 5 of those different areas within this committee. We're looking at prevention and wellness. I believe right now we've got about $10 billion a year going into a fund that's really going to be concentrating on prevention and wellness. And what I've always said is we in America, we've got to do a better job at keeping care of ourselves. So a lot of it's our responsibility. We've got to do that through eating right and exercising right and not smoking and all those other things that we know about. But we've also got to be sure that we pass that on to our children. But anyway, prevention and wellness is a big aspect. The other one is workforce coverage. We've got to be sure once we get a system like this in place that there's the physicians available and the nurses and the technicians that are going to be able to treat all of those 47 million people who are currently uninsured now once they actually go to facilities that they can find treatment. So there's a big component of what we're doing right now on workforce, being sure we have the capability. The other one is actually the coverage. How is this going to be modeled? And you've heard, and I know a lot of you here are talking about the public plan. I don't really care what we call it, as long as it works and as long as it does what's right for the pre-existing conditions, affordability, accessibility, and to be sure that you get the treatment that you need.